I lost my daughter Aurora at 22 weeks gestation, and so it's just been incredible to be able to draw inspiration from my own personal experience. Stillbirth is defined as the death of a baby at 20 weeks gestation or more, or when the baby weighs 400 grams or more. The most common causes of stillbirth are congenital anomalies, as well as spontaneous preterm birth, but up to 15% of all stillbirths also remain unexplained. There's a few risk factors for stillbirth, so some of these include smoking, advanced maternal age, as well as obesity, and a couple of maternal conditions. There's also a number of women who can go on to have a stillbirth without any of these risk factors. They're not a statistic and they're not just part of a data set, they're a family, they're parents that have gone through this. So, if we can work towards interventions that could even just save one life, we would be happy researchers, I think.
We now have the Safer Baby Bundle, and that's a national initiative that's aiming to address the 5 key risk factors for stillbirth. These include maternal smoking in pregnancy, how we better identify and manage pregnancies where the baby is small, maternal sleeping on side position, being aware of fetal movements in pregnancy, and timing of births. My research actually identified that there may be differences in the gestation length for South Asian born women. So these are women who were born in India, Bangladesh, Pakistan, Sri Lanka, experience significantly higher rates of stillbirth at the end of pregnancy than other women giving birth here in Australia. We were able to tweak the care that we provide to women at the end of pregnancy to commence earlier for women of South Asian background. We were able to significantly reduce the rates of stillbirth for South Asian women at term. Most of the work that goes into preventing stillbirth focuses on care at the end of pregnancy. However, the majority of stillbirths actually occur in the preterm period. Nobody has looked at the endometrium or what happens at the time of conception and whether there's factors or differences in the endometrium that might predict these stillbirths. For us to be able to get funding to do the big projects, we often have to show that we've already done some of the work so that our hypothesis stands and that we show that we're capable of doing it. By supporting the Women's Health Appeal, you help us generate that new data to help us take the research forward.